Hi, my name is Dr. Evan Dunn. I'm a retina specialist located in Tampa, Florida, and the co-founder of I Know More.
And my name is Dr. Sanket Shah. I'm a retina specialist located in Ventura, California, and the co founder of I Know More.
I Know More's course on age-related macular degeneration will allow you to take your eye health into your own hands and arm you with the knowledge needed to maximize your vision. You will feel optimistic and empowered upon completing this course. The course will begin with an introduction of the essential knowledge needed to understand the eye and how it is affected by the different stages of age-related macular degeneration, also known as AMD. We will then delve into what patients experience in the different stages and what to expect at the doctor's office. From there, we will transition into the treatment for dry AMD and most importantly, focus on how you can reduce your risk of losing vision from dry AMD. Next, there will be a detailed discussion regarding the treatment for wet AMD, of course, with no unsightly graphic photos of procedures. We will then provide some helpful tips on strategies to maximize vision and functioning with all stages of macular degeneration. The entire presentation will be around 1 hour and may be viewed as many times as one desires. You will feel better and have the tools needed to maximize your vision by the end of our course.
Research and clinical trials help discovery of new treatments. Your doctors learn about these treatments through training, conferences, and journals. But when it finally comes to the patients, there is a disconnect. Most patients that we have spoken to have very little understanding of their eye disease and the treatments that they are receiving. Moreover, there is a lot of misinformation among patients that creates a lot of fear and stress about their vision. We strongly feel that this course will help bridge the disconnect between you and your eye health. It is our goal to involve you in your own eye care, understand the eye condition better, make choices about the treatments you receive, have realistic expectations, and be better prepared about the vision outcomes to expect. We believe that educating our patients is a very important part of the treatment process. This course from I Know More will help you understand different aspects of macular degeneration or AMD in simple language. We have used cartoon figures to illustrate the condition and the treatments. We will also discuss tricks on how to maximize your vision and functioning even if you have low vision. Feel free to take notes as you go through this course and enjoy. The first step in understanding your eye condition is to know the different parts of the eye. This is an eye as we see it from the outside, from the front. This is a model eye as seen from the front. Here you see the eye from the side. As you can see, only a small part of the actual eyeball is visible from the outside, and the remaining is covered by eyelids and protected by the bones of the eye socket. This is the model eyeball as seen from the side. It is spherical like a ball. What is inside the eye? Imagine viewing the inside of the eye from the side. This is how it looks. Think of the eye like a camera. It has a lens and a film. The lens focuses the light on the film. You need to have a good film to get a good picture. Similarly, you need to have a healthy retina to be able to see well. The eye has a lens inside it, and the part behind the lens is commonly referred to as the back of the eye. It's like a room, and the inside of it is lined with wallpaper called the retina, which is the part that sees light. The lens focuses the light on the retina. When we talk about the eye color, what we really mean is the colored part of the eye called the iris. The center of the iris has a hole called the pupil, which controls how much light gets into the eye. There is a clear window in front of the iris called the cornea that allows light to enter the eye. The cable that connects the eye to the brain is called the optic nerve. It carries the image created by the retina to the brain. When we see an object, light from the object enters the eye, it passes through the cornea, and the iris controls how much of the light reaches the retina. The lens then focuses the light onto the retina. The image formed in the retina is then carried by the optic nerve to the brain to give the sensation of our vision. Let's look at the retina, the wallpaper that lines the back part, in detail. The center of the retina is called the macula. Actually, let's turn the eye around and focus on the macula. The orange part is the center of the retina, called the macula. This part contains light-sensitive cells and gives you the detailed central vision. The green part under it is called the choroid, and it has blood vessels that provide nutrition to the retina. The brown part is a layer of cells called the retinal pigment epithelium, or RPE, that separates the retina from the choroid. It allows nutrition to pass from the choroid to the retina and removes waste products from the retina to the choroid. When light reaches the retina, it stimulates the light-sensitive cells in the macula, a chemical reaction occurs, and an image is created. During this process, some waste products are formed from the chemical reaction, and these are removed by the RPE to the choroid. When we are younger, this process is pretty efficient. As we get older and the retina ages, the RPE function can reduce with time, and some waste products may remain under the retina or the RPE. These yellowish deposits that accumulate under the retina are called drusen. As time passes, more drusen can accumulate. Drusen can occur as part of normal aging and may never lead to macular degeneration. But when they are more than expected with age, it leads to early or intermediate stage of dry macular degeneration. Dry macular degeneration is the most common type of macular degeneration. Let's look at what happens in advanced stage of dry macular degeneration. Here we see that the areas with drusen advance to form atrophy. What it means is loss of light-sensitive cells of the retina, the orange layer, or the RPE, the brown layer. This can result in missing areas in the vision. Atrophy can expand with time. In some patients, dry macular degeneration can convert to the wet macular degeneration. Let's see what is different about wet macular degeneration. Here, as you can see, a large bump forms under the retina, and the choroid, the green tissue, responds to the ongoing damage by forming a new blood vessel in an attempt to supply the retina or the RPE that is not receiving enough oxygen and nutrients. While this seems like a good thing, in reality, the new blood vessel is bad. It is fragile and leaks and bleeds, causing the retina to swell and this reduces the vision. There can be leakage under the retina and swelling of the retina. There can also be bleeding from the new blood vessel. Later, this can form a scar, which can cause permanent vision loss in that area. Both wet and dry macular degeneration changes can occur in the same eye and can get worse with time. There can be a scar from wet macular degeneration and atrophy from dry macular degeneration adjacent to it, as shown here.
Okay, so let's review macular degeneration, dry and wet types, and compare to the pictures that your retina doctor gets in the office. Macular degeneration is also called age-related macular degeneration, or AMD for short. So let's begin. This is the normal appearance of the inside of the eye. The yellowish circle that you see on the left is the optic nerve, and the red wavy lines coming from it are the blood vessels, and the entire orange area is the retina. The macula is the center of the retina. If we draw a line through the center of the macula and look at it in cross-section, it looks like this. Your doctor commonly gets a test called OCT, or optical coherence tomography. The OCT shows the macula in cross-section like this image on the top, comparable to the actual cross-section of the macula below. Imagine the macula is like a cake, and the OCT allows us to see the different layers of the cake. Each of the lines, which are different shades of white and gray, represent different layers of the retina. This is the macula showing yellow deposits under the retina called drusen, which, as we know, are accumulations of waste products. Here, the drusen are seen as small bumps on OCT. Patients fortunately have no changes in their vision at this stage. Many patients have no progression to more severe forms of AMD, but others may. It is not recommended to initiate vitamin supplementation at this stage. However, it is important to recognize this condition, and your doctor monitors this every 12 months. When the drusen increase in size and number, and there are changes in the retina pigment epithelial layer, it leads to early and then intermediate dry AMD. As you can see, the yellow spots are larger and more numerous here. This is the OCT showing many drusen, bumps under the retina, in intermediate dry AMD. Most patients have no symptoms at this stage, and very rarely patients may notice a distortion in the central vision related to drusen underneath the central macula. Amsler grid self-monitoring and ARED supplementation are recommended at this stage, which will be discussed in significant detail later. Your doctor will monitor this condition about every 6 months. From this stage, the disease may progress variably. The drusen may remain stable at the same stage of early or intermediate AMD, or the disease may progress to atrophy, causing advanced dry AMD, or it may progress to form new blood vessels under the retina called wet AMD. The majority of patients fortunately have stable drusen, which do not progress past the earlier intermediate stage of dry AMD, and therefore causes no or minimal effects on the central vision. In advanced dry AMD, there is atrophy, which means a loss of light-sensitive cells of the retina, or retina pigment epithelium. This can result in missing areas in the vision. This is a color photo of the macula showing the atrophy that can expand with time. This is the autofluorescence test, which shows dark areas corresponding to atrophy. This is the OCT and the cross-section image of the macula showing atrophy, seen as thinning and loss of retinal and retina pigment epithelial layers. In some patients, dry AMD can convert to wet AMD. A large bump forms under the retina, which is the orange layer, and the choroid, which is shown in green, and forms new blood vessels. This is not good because they leak and bleed, causing the retina to swell and reducing the vision. There can be leakage under the retina and swelling of the retina. There can also be bleeding from new blood vessels. Early treatment with injections can help. This is a color photo of the macula showing leakage, swelling, and bleeding. Here you can see the OCT showing the bump in leakage from new blood vessels. Your doctor may recommend forcing angiography to confirm the diagnosis of wet age-related macular degeneration. In this test, an orange color dye is injected into a vein in your arm, and photos of the retina are taken to capture the pattern of dye leaking through the blood vessels. Leakage of the dye, as seen here, suggests that there are new blood vessels and helps confirm the diagnosis of wet age-related macular degeneration. Early treatments can help reduce the leakage and preserve and improve vision in wet AMD. This test has minimal side effects, which mainly include your urine being orange colored for a couple of days, and about 10% of patients experience some very transient nausea. Other side effects are extremely rare. In late stages of wet macular degeneration, a scar may form, which can cause permanent vision loss from that area. Here you can see that over time the retina heals with forming a scar. This is the color photo of the macula with the scar. This is the OCT showing the scar. Sometimes elements of both wet and dry AMD may affect the same eye and may get worse with time. There can be a scar from advanced wet macular degeneration and atrophy from advanced dry macular degeneration adjacent to it. This is a photo of the macula showing scar and atrophy both in the same eye.